Hello, my friend. Everyone says calcium is the key to strong bones, but what if I told you there's another vitamin that might be even more important? One that quietly slips through the cracks of most diets. And could be leaving your bones weaker every single day, even if you're doing everything right. Today, we're uncovering the number one vitamin you're likely missing for true bone strength, and it's not calcium. It's not magnesium. And it's not even vitamin D, but it might just change the way you age, gracefully, confidently, and independently. Let me tell you a story. Marjorie was 72 when she broke her hip stepping off a curve outside her church. No accident. No trauma. Just one simple step, and suddenly, she was on the ground, in pain, and unable to get up. She'd been taking calcium supplements for over 10 years, drinking milk, and walking every day like her doctor recommended. Lying in the hospital bed, she looked at her daughter and asked, "I did everything right. Why did my bones still fail me?" It's a painful question. And unfortunately, it's one that thousands of older adults ask every single year, after they've followed all the conventional advice. Here's the hard truth: something vital is missing from the picture. A powerful, under-discussed vitamin that helps direct calcium to the right places, your bones, and keeps it out of the wrong ones, like your arteries and joints. This could be the reason why, even with supplements and healthy habits, fractures still happen. And once you understand this missing piece, everything changes. Your supplements work better. Your bones get stronger. And your risk of fractures could finally start to go down. Let's talk about the real bone builder your body is begging for. For decades, we've been taught that calcium is the cornerstone of strong bones. And to a degree, that's true. Your bones are made of calcium, after all. But calcium doesn't work alone. In fact, without the right supporting nutrients, calcium can go to the wrong places in your body, doing more harm than good. That's where things get dangerous, and where the real story begins. Let's break this down simply. When you take calcium, whether through food or supplements, it enters your bloodstream. But from there, your body needs to decide where to send it. Ideally, calcium should be delivered to your bones and teeth to support strength. But if it isn't properly directed, it can settle in places like your arteries, kidneys, and soft tissues. That leads to problems like calcified arteries, kidney stones, and joint stiffness. That's where vitamin K2 comes in. And this, my friend, is the unsung hero most seniors have never heard about. Vitamin K2 acts like a traffic controller for calcium. It tells calcium exactly where to go, and more importantly, where not to go. It activates proteins like osteocalcin, which bind calcium to bone, and matrix GLA protein, which helps prevent calcium from hardening in arteries. Without enough K2, the calcium you take could bypass your bones entirely and contribute to health issues you're trying to avoid. So why haven't we heard more about vitamin K2? Because it's often overshadowed by its cousin, vitamin K1, which is abundant in leafy greens and known for its role in blood clotting. But K1 and K2 are not the same. Vitamin K1 stays mostly in the liver, managing clotting. Vitamin K2, on the other hand, travels through the bloodstream to bones and blood vessels, playing a key role in long-term bone and cardiovascular health. In countries like Japan and the Netherlands, where diets are naturally richer in K2, from foods like natto and aged cheeses, studies have shown significantly lower rates of hip fractures and artery calcification in older adults. One long-term Dutch study even found that people with the highest intake of vitamin K2 had a 50% lower risk of dying from heart disease. That's not a small number. Now, to be clear, this doesn't mean you should stop taking calcium or vitamin D. Those nutrients are still essential. Vitamin D helps you absorb calcium from your food or supplement. But once calcium is in your bloodstream, vitamin K2 decides what happens next. Think of them as a team. Calcium provides the raw material. Vitamin D opens the door to let calcium in. Vitamin K2 guides the calcium to your bones and keeps it out of harm's way. If any part of this team is missing, the system breaks down. That's why so many older adults, like Marjorie, end up with brittle bones despite taking calcium every day. It's not that they were doing anything wrong. It's that no one told them about the crucial role of vitamin K2. Fortunately, it's not too late. Once you learn how to get enough K2, through the right foods, supplements, and habits, you can finally give your bones the full support they need. Up next, let's dive into what you can do right now to get more K2 into your life, safely and naturally. 1. Add more vitamin K2 rich foods to your plate. If you want to strengthen your bones naturally, one of the best ways to start is by adding more vitamin K2 rich foods to your plate. Unlike vitamin K1, which is abundant in leafy greens, K2 comes from fermented and animal-based sources, foods many older Americans don't eat often enough. Let's begin with the highest natural source of vitamin K2, natto. This is a traditional Japanese food made from fermented soybeans, and while its sticky texture and strong flavor may not appeal to everyone, it contains an incredibly high amount of K2, especially the MK7 form, which is the most bioavailable. Even a small serving can deliver more than enough of your daily requirement. If natto isn't your style, don't worry. There are plenty of Western-friendly options. Aged cheeses, such as Gouda, Edam, and Jarlsberg, are excellent sources of K2. Just 1 or 2 ounces a day can contribute meaningfully to your intake while adding flavor and satisfaction to your meals. You can also find K2 in egg yolks, especially from pasture-raised chickens, as well as in grass-fed butter and organ meats like chicken liver. These traditional, nutrient-dense foods have fallen out of favor over the years but are making a comeback for good reason. They nourish the body in ways modern processed foods simply can't. Try rotating these into your weekly meals. Scrambled eggs for breakfast. A slice of Jarlsberg with lunch. Liver pâté as an appetizer. These small changes, over time, can make a powerful difference in your bone health. Remember, consistency is key. Your bones don't just need calcium, they need direction. And vitamin K2 provides it. 2. Choose the right supplement, if needed. While food should always be the foundation of your nutrition, many older adults may still benefit from a vitamin K2 supplement, especially if their diet is limited or they have absorption issues. But not all supplements are created equal, so it's important to know what to look for. First, make sure you're choosing the right type of vitamin K. Many labels simply say vitamin K, but often they refer to K1, not K2. You'll want to look specifically for vitamin K2, and ideally, you should know the subtype, MK4 or MK7. MK4 is found in animal products and tends to have a shorter half-life in the body, meaning it may need to be taken multiple times a day. MK7, found in fermented foods like natto, stays in your bloodstream longer and usually requires only 1 daily dose. For most people, a daily dose of 90 to 200 micrograms of MK7 is safe and effective. It's often sold on its own or combined with vitamin D3, which is a smart choice since the two work together to move calcium properly. Always check for third-party testing and avoid supplements with unnecessary fillers or artificial colors. And, this is critical, speak to your doctor, especially if you're on blood-thinning medications like warfarin, which can interact with vitamin K. A good supplement should complement your diet, not replace it. Use it as a tool to fill the gaps, and give your bones the support they truly need. 3. Combine K2 with D3 and calcium correctly. When it comes to bone health, it's not just about what nutrients you take, it's about how you take them together. One of the biggest mistakes many older adults make is focusing solely on calcium without considering how vitamin D3 and K2 work alongside it. Think of them as a team, each has a unique role, and they depend on one another to get the job done right. Here's how the synergy works. Vitamin D3 helps your body absorb calcium from your food or supplements. Without it, much of that calcium would simply pass through your system unused. Vitamin K2, as we've discussed, takes that calcium and guides it into your bones, preventing it from depositing in your arteries or soft tissues. If you're taking calcium alone, without D3 and K2, you may not be building strong bones. In fact, you could be increasing your risk of arterial calcification, which is a known contributor to heart disease. That's why some of the most effective bone health supplements combine calcium, vitamin D3, and vitamin K2 in one formula. This balanced trio ensures the calcium you absorb is used efficiently and safely. But remember, more isn't always better. The goal isn't to overload your system with calcium but to optimize how your body uses it. Seniors typically need around 1,200 milligrams of calcium per day from both food and supplements combined, along with 600 to 800 IU of vitamin D3 and 90 to 200 micrograms of K2. Supporting your bones means giving your body the right tools, in the right balance, to do what it's naturally designed to do. 4. Avoid this common medication mistake. Here's something many people don't realize: certain medications can interfere with vitamin K2, reducing its benefits and potentially putting your bone and heart health at risk. One of the most common culprits: warfarin, a widely prescribed blood thinner. Warfarin works by blocking the action of vitamin K to prevent blood clots. The problem is, it doesn't distinguish between vitamin K1, which is involved in clotting, and vitamin K2, which is crucial for bone strength and artery health. As a result, people taking warfarin may end up deficient in both, without even knowing it. This can lead to two serious issues over time: weaker bones and hardening of the arteries, both of which are common in older adults. If you're taking a vitamin K blocking medication, it may be silently undermining your bone health, even if you're doing everything else right. But don't panic. This doesn't mean you have to stop your medication. It just means you need to have a conversation with your doctor. In recent years, some healthcare providers have begun allowing stable, low-dose vitamin K2 supplementation even for patients on blood thinners, because maintaining consistent levels may actually support better long-term outcomes. The key word here is consistency. Sudden changes in vitamin K levels, either up or down, can affect how warfarin works. That's why it's so important to manage these nutrients under medical supervision. Your doctor may suggest a newer anticoagulant that doesn't interfere with vitamin K, or help you develop a safe plan to support your bones while protecting your heart. Knowledge is power, and now, you know what questions to ask. 5. Bone strengthening daily habits beyond food. While nutrition is vital for strong bones, it's only one part of the equation. The truth is, your daily habits matter just as much, especially the ones that support your body's ability to absorb and use the nutrients you take in. First, let's talk about movement. Gentle, weight-bearing exercises are incredibly effective for maintaining and improving bone density. That doesn't mean you have to hit the gym or lift heavy weights. Simple activities like walking, tai chi, light resistance training, or even climbing stairs can stimulate your bones and keep them strong. Just 20 to 30 minutes a day can make a big difference over time. Next, consider your sunlight exposure. Your body makes vitamin D naturally when your skin is exposed to sunlight, and that vitamin D plays a direct role in how calcium is absorbed. Aim for 10 to 20 minutes of sunlight on your arms or legs most days, if possible. Just be sure to do it safely. Don't forget about hydration, either. Staying well hydrated helps your kidneys process excess minerals and supports overall health. Seniors often experience a reduced sense of thirst, so set reminders to sip water regularly throughout the day. And finally, rest. Sleep is when your body repairs and rebuilds, including your bones. Aim for 7 to 8 hours of quality sleep each night, and try to keep a consistent bedtime routine. Remember, bone health isn't just about what you eat. It's also about how you move, rest, and live. These everyday choices create the environment your body needs to thrive. 6. Know the warning signs of deficiency. One of the trickiest parts about a vitamin K2 deficiency is that it doesn't usually show up in obvious ways, until it's already causing damage. But if you know what to look for, your body may be giving you subtle signals that something's off. Let's start with your teeth and gums. Bleeding gums, despite good brushing habits, may be more than just a dental issue. K2 plays a role in regulating calcium in the mouth as well, and a deficiency can contribute to gum disease and tooth decay, even in people who floss regularly. Another common sign is excessive stiffness or joint discomfort. If calcium isn't directed to the bones, it can settle in soft tissues and joints, making movement feel tight or painful. While this could be due to arthritis or aging, a lack of K2 might be silently contributing to the problem. You might also notice brittle nails, easy bruising, or even fatigue. Though these can have multiple causes, they're sometimes connected to poor nutrient absorption or imbalances that K2 can help address. And here's a big one: arterial calcification. While this isn't something you can feel, it shows up in scans or during checkups. If your doctor has mentioned calcium buildup in your arteries, or if you have high blood pressure alongside osteoporosis, it may be time to ask whether K2 could help. Your body is always talking, you just have to learn how to listen. Paying attention to these early signs can help you take action before bigger problems set in. 7. Build a weekly bone health plan. Now that you understand the power of vitamin K2 and how it works with calcium and vitamin D, the next step is putting it into action. And the best way to do that? Create a simple weekly bone health plan, one that fits your lifestyle and sets you up for success. Start with food choices. Aim to include K2-rich items at least 4 to 5 times per week. For example, Monday, scrambled eggs with sautéed spinach and a slice of Jarlsberg cheese. Wednesday, a small serving of chicken liver or a liver pâté spread with whole grain toast. Friday, a salad topped with hard-boiled egg yolks and shredded aged cheese. Sunday, treat yourself to a few bites of natto or add a spoonful to a rice bowl if you enjoy adventurous flavors. Next, if your doctor approves, add a K2 supplement, especially if your diet doesn't regularly include these foods. Choose an MK7 supplement and pair it with your daily vitamin D3 for optimal effect. Now, layer in supportive habits. Daily walks, 20 to 30 minutes. Stretching or light resistance exercises 3 times a week. 10 to 15 minutes of sun exposure in the morning. 7 to 8 hours of sleep each night. Plenty of water throughout the day. Finally, set a weekly check-in with yourself. Are you moving? Sleeping? Eating intentionally? These small moments of reflection help you stay on track. Consistency is key. A little bit each day adds up to stronger bones, better balance, and a more confident future. Start this week, and give your body the support it's been waiting for. Let's pause for a moment and think about what strong bones really mean in our lives. It's not just about avoiding fractures or worrying over test results. It's about the freedom to walk to your garden without fear. To carry groceries, climb stairs, or dance at your granddaughter's wedding. It's about being able to live your life with confidence, dignity, and independence. That's why this conversation about vitamin K2 isn't just a health tip, it's something deeper. For many older adults, the slow weakening of bones doesn't just affect the body. It chips away at your spirit. The anxiety after a fall, the frustration of being told to take it easy, the sadness of watching your world shrink because your body can't keep up, it's heartbreaking. But here's the good news: you are not powerless. And it's never too late to strengthen what's been neglected. Remember Marjorie? After her hip fracture and hospital stay, she felt discouraged. She had done what she was told, taken calcium, exercised, stayed active. But after learning about vitamin K2, she started asking questions. She changed how she approached her nutrition, worked with her doctor to find the right supplement, and added gentle movement back into her life. 6 months later, she wasn't just stronger physically, she felt hopeful again. Because that's what knowledge can do. It doesn't just protect our bodies, it revives our spirit. It reminds us that we're still in control, even in later chapters of life. If you've been living with the quiet fear that your bones might betray you, know that there's a path forward. It starts with understanding. It builds through consistent habits. And it grows with every small step you take, whether that's choosing a better breakfast, stepping outside for a short walk, or simply asking your doctor the right questions. You don't need to overhaul your life. You just need to make intentional choices, one day at a time. We all want to age with grace, strength, and peace of mind. And the truth is, your body is incredibly resilient when you give it the tools it needs. So today, I hope you walk away with more than information. I hope you feel empowered. Because your bones aren't just holding up your body, they're holding up your future. And with the right support, you can make that future stronger, steadier, and far more joyful than you imagined. Now that you've learned the truth about vitamin K2, it's time to take that knowledge and put it into action, gently, confidently, and in a way that supports your unique lifestyle. The first step is simple: review your current habits. Are you taking a calcium supplement? Are you getting enough vitamin D3? And most importantly, have you ever even considered whether vitamin K2 is part of your routine? Next, take a look at your meals. Can you add just one K2-rich food this week? Maybe start your morning with a couple of pasture-raised eggs, or enjoy a slice of aged cheese with lunch. If natto isn't your thing, that's okay, choose what feels realistic for you. The goal isn't perfection. It's consistency. If your doctor gives you the green light, consider a K2 supplement, especially if your diet is limited or if you're on long-term medications that may interfere with absorption. Always choose supplements that are clearly labeled with the form and dosage, preferably MK7, and avoid unnecessary fillers. Most importantly, talk to your healthcare provider. This is a conversation worth having. If you're over 60, have a family history of osteoporosis, or have experienced fractures or stiffness, your bones may already be calling for help, and now you know how to answer. So here's your challenge: make just one change this week. One intentional shift in your meals, your supplement routine, or your daily movement. And if you found this video helpful, please like, subscribe, and share it with someone you care about. You never know whose life might be changed by learning about this one missing vitamin. At ElderSpark, we believe aging should be strong, not fragile. You're not too old to rebuild, renew, and thrive. Let this be your spark. Let's quickly recap what we've learned today. While calcium and vitamin D are important, they aren't enough on their own to protect your bones. The real game changer is vitamin K2, the overlooked nutrient that tells calcium where to go, guiding it into your bones and keeping it out of places it doesn't belong, like your arteries and joints. You can get K2 naturally from foods like natto, aged cheeses, egg yolks, and organ meats, or through a well-chosen MK7 supplement, especially if your diet is limited. We also covered key daily habits, like gentle movement, sunlight, hydration, and sleep, that help your body make the most of every nutrient. And remember the subtle warning signs of deficiency: bleeding gums, stiff joints, brittle nails, and even artery calcification. Your body gives clues, it's up to us to listen. So if you're serious about protecting your independence and strength as you age, don't ignore this missing piece. Your bones are your foundation. Nourish them wisely, and they'll carry you forward with confidence. Thanks for spending time with us here at ElderSpark. Stay strong, stay informed, and we'll see you in the next video.